I have the pleasure of meeting. I'm Chris Hayes, Dean of Faculty, and I would like, as the last people are coming in, to commence proceedings today by acknowledging the traditional owners of the land on which this event is taking place, and to pay my respect to elders past and present. Considering the Aboriginal history of this site, we're on the shores of a big river. We're part of a big country in an ancient land. And I'm sure this is not the first time that people have travelled and gathered and dreamt and built friendships and considered big ideas, as is the theme of this ANZCA conference. So welcome to our delegates, welcome to healthcare industry, to our major sponsors and exhibitors. Thank you to Dr. Kath Cook and her organising committee for bringing an outstanding program together. Thank you to all who gather with us today to make this meeting possible. This is our 15th Pain Refresher Day course, and the theme of the day is Big Specifics. So we do have three speakers to follow our opening session. We have Professor Chris Eggleston. He's talking some big ideas in evidence base. We have Matthew Bryant talking some big geographical ideas about rural and remote, and Hilary Tardif talking big data. But before we get to that, another big specific that has been on the drawing board on the think tank of the faculty for some time is better pain management, and I would like to invite Dr. Mick Bagg to come and officially launch the Better Pain Management Program. Mick, thank you.
Thanks, Chris. Welcome everyone to the launch of Better Pain Management. I'd especially like to welcome our viewers on Periscope app, watching at home or at work, or wherever on the internet you're watching from. This presentation today is the culmination of a vision that began 4 years ago. The faculty was involved in the development of 6 one-hour e-learning modules in collaboration with the College of GPs entitled Effective Pain Management in General Practice. And the vision that we had was to make these modules available to a wider audience and to add to the number of topics that were covered. So funding was procured, it sounds easy when you say it like that, and a steering committee was formed consisting of Professor Ted Shipton, Associate Professor Brendan Moore and myself. Being the only non-dean on the steering committee, I was of course delegated to be chairman. We were committed to delivering content that was credible and cutting edge, but also broadly accessible. And we looked at the CPD requirements for GPs, for nurses, physiotherapists, OTs, pharmacists, and designed a product which would meet or exceed all of their requirements, so it would be immediately useful to them. We needed the learning to be in a user-friendly manner that would be easy to find and easy to navigate. We wanted it to be customisable so that we could offer bundles of modules that would suit different craft groups and different training requirements. We insisted that it had to be cost-effective to users and yet potentially able to self-fund in the long term. So the challenges were pretty big, from assembling and coordinating our expert author groups to planning the complex technical IT infrastructure that was required. There were many challenges that we had to rise to. And the result is a program that we think delivers on all these things. The content is world class and yet it's accessible to any health professional who wants to have a look at it. And I'm very proud of our faculty's response to the task of engaging and supporting with our allies of all disciplines who join us in the war on pain. The simple but stunning facts that we don't need to dwell on to this audience are that we don't really do enough to prevent poor life outcomes in people who have persistent pain. The problem is one of access and it's one of scale, and it isn't getting better as time goes by. Health professionals on the front line often lack up-to-date knowledge of the complex and evolving field that we are experts in. And there may be no other area of healthcare where the lab is so far ahead of the clinic than pain. The challenge is to empower our allies to be part of the solution. And yet we know that if all we did now was actually implement the best available knowledge that we have, the economic and societal benefits would be enormous. So we need to take on the scale of the problem as well as attending to the details of the care, and we need to multiply the reach of our fellowship's expertise by distilling it, bottling it, and delivering it to where it's needed the most. Better pain management is our first big step in this direction. It contains the information that pain specialists want everybody else to know. It provides both theoretical and practical advice that will change practice quickly and for the better. And the customisable delivery means that the bundles can be tailored to craft groups or to individual users. The modules of BPM are in keeping with the faculty's interdisciplinary DNA. We sought out experts in other fields that were relevant to the topics, but the bulk of the authors are our own faculty fellows with years of practical experience on the front lines. Now I'm told that if there's any millennials watching, we need to have a video. So here's the video. To acknowledge the authors of the modules whose familiar names you see scrolling past the screen now. And I'd also like to publicly record our thanks to the funding organisations that will be listed in a moment. This was an expensive project, over $250,000, and that it absorbed a lot of funding would never have happened if these organisations had not had the vision to invest in it. From the College of Anaesthetists, I'd like to thank Andrew Stapleton from Education, Richard Stanton and his team from the Strategic Project Office for their hard work in the implementation and testing phase. Particularly like to thank John Eilert, the CEO, for his wholehearted support of the project. I'd like to thank Peter Frey from the faculty staff who prepared these slides and a number of other promotional materials. Special mention to the FPM General Manager, Helen Morris, who has done a mighty job over the last few years, keeping the project in safe hands as it navigated through some stormy times. My fellow steering committee members, Ted and Brendan, have done a tremendous amount of pro bono work on this project. I'd like to mention Brendan in particular for his vision and drive in the early part of the project, not to mention his deft touch at accumulating the funding grants to get the project underway. I think it's safe to say that Brendan is possibly the only person in this room who's more relieved than me to see this launch happen. So there you have it, fellows of the faculty. The website is live, the modules are out there. I'd encourage you to check it out, but more importantly, I'd encourage you to mention it in every interaction you have this year with our allied health, nursing and medical colleagues. Spread the word to them that the faculty has listened and it's responded to their need for high quality, unbiased education in pain management. Tell them that the time for better pain management has come. Thank you.
Nick, thank you. Better pain management certainly fits in with the big specifics theme of today. Let's roll on though. Our first speaker visiting us from the UK is Professor Chris Eccleston. Chris, at your leisure, you might like to make your way up to the podium. Chris